Welcome back to the Vanderbilt Otolaryngology Residency Program. My name is Brandon Isianor. I'm a fourth-year resident.
And my name's Julia Brennan, and I'm a third-year resident. And today we want to share with you some of our research programming. In the absence of being able to show you in person, we'll tell you about it.
Specifically, we want to showcase and highlight some of the amazing opportunities available at Vanderbilt and how our residents have leveraged these opportunities to build their projects.
We'll also talk to you about some of our professional development opportunities and ways that this program can make you into the surgeon, the scientist, and the leader that you're meant to be.
Your job is to come with the idea. Our job is to provide you with the resources through mentorship, financial resources, and collaborative connections to bring your idea to life.
So third year starts with a 2-week research boot camp where we're free of all clinical duties and obligations, and we really get to focus on starting projects and learning how to do scientific research.
Coming into residency, everyone has variable experience in terms of what they've learned in medical school about how to do research, the different steps and different types of research that you can do. And so that 2-week period is really valuable just to figure out what resources you have available to you and give you the building blocks you need to do clinical research, basic science research, and sort of figure out what Vanderbilt has to offer. I think it's a really great launch pad into the 5 months that we have dedicated for research in third year.
Vanderbilt has a unique setup in which the medical center is just across the street from the basic science center. And that synergy, I think, is unparalleled nationwide. It's supported by grants on the basic side, grants on the clinical side, and grants bridging the two.
In addition to basic science opportunities, residents have the opportunity to be involved in translational research, which includes clinical trials that both of us have led as residents.
While some clinical trials may take years to really come to fruition, we really identified a need with the COVID-19 pandemic and put together a trial funded by the NIH looking at nasal saline irrigations as a potential therapeutic option for treatment of these patients.
At least on an odologic surgical perspective, we do more cochlear implants than anyone else. Our institution has pioneered bundling care for cochlear implants and doing same-day cochlear implant where a patient has their first clinical evaluation and their surgery on the same day. We've been able to leverage the fact that we do so many cochlear implants into making clinically relevant experiments.
The intraoperative CT scanner that we use is actually housed right next door to our temporal bone lab, where I've actually done a lot of my own research, readily available to any of the researchers who want to use it for imaging temporal bones, cadavers, or whatnot for our research studies. The temporal bone lab is open to us for research or professional development use 24 hours a day, 7 days a week, only 3 floors up from our clinic space and 7 floors up from our operative space.
Not only do we have a lot of awesome work going on here at Vanderbilt, there's tons of things going on globally. One of our awesome attendings, Dr. Netterbill, does work trips to both Haiti and Kenya.
Dr. Belcher, also was the head of the Humanitarian Aid Committee of the Academy, and led all those efforts internationally this year. And we do good work in Guatemala as well with him and doing cleft palate work. So there's just a ton of opportunity.
These trips are awesome. There's a lot of emphasis on teaching the local physicians and local residents who come visit. As a resident, I think there's a lot more emphasis on research.
One of the major projects that I have been involved in has been focused on teaching point-of-care ultrasound to healthcare providers, both residents and attendings in Kenya, to substitute for the lack of advanced imaging modalities that are available that we often might take for granted here in the US.
Outside of research, there's tons of professional development opportunities here as well.
For instance, I'm currently taking a class at the Wondry, which is Vanderbilt's Center for Innovation, Entrepreneurship, and Design.
You can really do anything here.
Last year, I created the Star Odo Initiative through the support of the department, the Center for Technology Transfer, and the many resources available through the Vanderbilt family.
The educational opportunities here at Vanderbilt are actually kind of top-notch across the board.
Yeah, otolaryngologists work so closely with speech pathologists and audiologists, so having the top-notch trained audiology and speech path students here learning with us together is phenomenal for our clinical education, our surgical education, but also for the research collaboration that we have. There's so many opportunities to work with them. They also tend to be involved in the Music, Mind, and Society program, which is a really cool music cognition lab here at Vanderbilt. Vanderbilt, where we're studying the effects of music and how basic science and medicine can correlate to art. So having all of that here, science meeting art, especially here in Music City, it's really cool that we can study how music really affects learning and how it improves children's education.
For my research, I took advantage of the Vanderbilt Institute for Surgery and Engineering, or VICE, V-I-S-E. It's a really strong collaborative effort between our mechanical engineering, computer engineering, chemical engineering, biomedical engineering, and surgeons themselves, where they all work together with us to try and implement everyone's strengths to the end of developing new technology. They taught me how to do CAD rendering, how to do 3D printing. Really, if you have an idea and you go to them with it, they can help you get from point A to point B to point C and fill in the gaps in what you may not know how to do.
One of the other opportunities we have is to really transition our medical education efforts to an online forum.
We essentially created this curriculum that brought together radiology and ENT residents in an interdisciplinary manner to learn about head and neck imaging correlated with clinical scenarios. And this is great because this curriculum doesn't exist. We're building it from scratch, got a $10,000 grant to be able to do that. I think the opportunity to really, take innovative ideas and put education on a platform that can be useful to others is one of the most exciting parts about being in residency here.
In addition to supporting us with our academy and other national conferences, our department has also encouraged us to get involved in committees. So it's really cool. I have the support of the department, in terms of mentorship, in terms of resources.
And a lot of our faculty on staff here are also similarly involved in healthcare policy and very passionate about ethics and things kind of outside the scope of what you would consider a normal otolaryngology practice.
And we can work together on so much of it. We have phenomenal basic scientists in our residency program. It's been really awesome to sort of learn what your strengths are and how you can use them together to further Vanderbilt's cause, to further otolaryngology, and to really improve our field for our patients.
As you can see, the opportunities at Vanderbilt are endless.
We're not just creating excellent otolaryngologists.
We're creating leaders in the field and leaders in our communities.